Great. So I'll start off with that the University of Alberta respectfully acknowledges that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. And with that, I'm going to introduce Diane Aubin, and she is the Executive Director of the Alberta SPOR Support Unit, and is responsible for the operations and strategic planning of the unit. And this is as of November of last year. In previous years, she was the Associate Director for the unit and ran capacity development programs such as the Summer Institute, Studentships, training programs, and a graduate credit program for the fundamentals of patient-oriented research. Diane has a master's in education and a PhD in educational psychology. And with that, I'll pass that on to her, and she will facilitate the rest of the presentation for the Alberta SPOR Support Unit. Thank you.
Thank you so much. Thank you for inviting us, Carol, and thank you everyone for joining us today on a Friday afternoon. So yes, I will be facilitating the session today. Hoping my job won't be too difficult because we have several of our key leaders here today, and it really does tell you how much of a priority it is for us to keep growing our connections with the Faculty of Medicine and Dentistry to make sure that you know who we are and that you reach out to us when you need us, and then we can work together. So today is a great opportunity for us to share some of the latest news about our unit, about the Alberta SPOR Support Unit, and even give you a little bit of background about SPOR for those of you who are still not quite familiar with our work. The presentations will take about 40 minutes, leaving enough time at the end for your questions. But as Carol said, please put your questions in the chat box as you go so you don't forget them. That's what I tend to do. If I don't put them down right away, I forget them. So please do that and we'll address them at the end. I won't be introducing each person now. I'm going to leave it for each of the presenters to just introduce themselves, who they are and what they do for SPOR. And that will ensure the flow just goes from one to the next. So, but I will say that Finlay McAllister is our scientific director, and he will be starting us off. Finlay.
Great. Thank you, Diane. So for those that don't know me, I'm a professor in the Division of General Internal Medicine here at the University of Alberta, and I dabble a little bit on the side in clinical epidemiology and health services research. So it's a great pleasure to talk to you today and update you about the Alberta SPOR Support Unit, or what we call AbSPORU. This slide is basically our webpage. So if you go to www.absporu.ca, you'll get this nice picture up. And importantly, you can see across the top, there's hyperlinks. And if you click on those, you can drill down into different aspects of everything that we're going to be talking about today. And the leads of each of those components who are associated with the University of Alberta are going to be talking to you later on this afternoon. Next slide, please. Thank you. So what is the Alberta SPOR Support Unit? Well, really, it was established in 2015. It was a grant co-funded by the Alberta Innovates for Health Solutions at that time and CIHR. So we received 5 years of funding, $48 million, to set up an infrastructure support unit in Alberta to provide access to assist people to do patient-oriented research. We have now been renewed for 2021 to 2026, as a typo there. As with everything else in life, there's a budget trim. So our budget is $26 million over the next 5 years. Half of that comes from CIHR again, and the other half is from provincial matched funding. And in a couple of slides, we'll talk about the different funding bodies. We're part of a network of SPOR units across the country. And if we can go to the next slide, please, Denise. So there are 8 provincial SPOR support units in Canada. There are 3 territorial support units. There are also 7 national networks. So there's a community-based primary healthcare research network. There's a mental health research network, and there are 5 chronic disease networks. And some of the people on this webinar I can see are actually from some of these networks. So there's Diabetes Canada, there's Solve CKD for kidney disease, there's Imagine for inflammatory bowel disease, there's a chronic pain network, and there's one for youth and mental health. Next slide, please, Denise. Our partners for the first 5 years of the AbSPORU were largely Alberta Innovates, CIHR, Alberta Health Services, Alberta Health, and then the research-intensive universities in Alberta, including obviously the University of Alberta. In AbSPOR 2.0, we've reached out and extended the tent much further to get a lot more of the other players in this ecosystem together. So we are collaborating with the Real World Evidence Consortium at the University of Alberta, University of Calgary, and the Institute of Health Economics, Wickery and Epicor at the University of Alberta, for machine learning, the AMI over in computing science here at the University of Alberta. We're also working closely with AHS, the Strategic Clinical Networks, the Alberta PICN, the Primary Care Research Network, the Physician Learning Programs, and the TOP program, Choosing Wisely. And nationally, we're also linked in with similar groups in the other provinces and territories. Next slide, please, Denise. So what is patient-oriented research? Patient-oriented research really is research that focuses on patient-relevant priorities. Now, they don't have to only be identified by patients. Clinicians, healthcare providers, family members can also identify patient-relevant priorities. And it really attempts to improve healthcare practices or policies to improve patient outcomes. Next slide, please. And really, a schematic to illustrate what AbSPORU does is the recognition that there's lots of great ideas out there to improve healthcare and health outcomes. And it's really the Niagara Falls on the left there. Everyone's got an idea. And really it's to help those ideas progress through the innovation pipeline to actually come out with an idea that's been tested, proven to work, and then to scale and spread that idea across the health system in Alberta. So what's called the learning health system, and Denise will tell you a little bit about that later on. Oh, a little too fast, Denise, but okay, I'll go with there. So the question is, what's the goal of AbSPORU? Well, AbSPORU supports individuals to do research in Alberta. But really our goal isn't just to produce more manuscripts or to have people's H indexes inflated, but it's really to achieve the quadruple aim. So improve the health of patients, the satisfaction of patients, of providers, population health, and also reduce care costs. And we'll be talking a little bit later this afternoon about learning health system. Next slide, please, Denise. So there are 4 key components of AbSPORU. You're going to hear from Yazid about the data science and research services component, and Jeff Backel will also tell you that. So we support primary data collection studies. We also support secondary use data studies, some health economics, and we also have some access to some resources for machine learning or artificial intelligence, particularly mining electronic medical records. And things like Connect Care definitely are on our radar screen, and we're working to get access to that data for individuals. You're going to hear from Denise about the learning health system and the strategies for AbSPORU to assist there. You're going to hear from Paul about capacity development from Kelly about capacity development initiatives within AbSPORU, and then from Paul about patient engagement initiatives. Next slide, please, Denise. Again, if you go to the website, you'll see basically a description of all the different things that can be supported by each of the teams within Alberta SPOR Support Unit. Next slide, please, Denise. The point of this slide, and the bottom unfortunately got cut off, but it's basically to show you that AbSPORU supports researchers doing projects in any field. So we're disease agnostic. We'll support, we have supported projects from all of the SCNs. We've supported projects from academics, non-academics. You'll see that about 45 to 50% of our requests have come from investigators based at the University of Alberta, the rest from the University of Calgary and Alberta Health Services, and then a smattering of other individuals through the province. You can see on the far right of the slide what kind of things that we assist with. If we go to the next slide, please. And I just want to point out, some people talk about AbSPORU and they say, well, I've never heard of it. I didn't know it existed. This is just a slide to show you that over the past 5 years, we've actually helped on over 1,200 requests 840 of those have actually been for data requests for secondary use data projects or primary data collection studies. We've also had over 265 training opportunities. We've had 8,100 trainees go through at least one of our courses. And there's a wide variety, as you're going to be hearing about, in the capacity development initiatives. And we've also awarded 54 graduate studentship grants, so about 8 to 10 grants per year. Next slide, please. Oh, there's a slide missing there. But anyway, so at this stage, I'm actually going to turn things over to Yazid, who's our scientific officer. And Yazid's going to tell you a little bit about the research and consultation services available within the AbSPORU. Thank you, Yazid.
Thanks very much, Finley. And I want to echo what Finley and Diane said. Welcome, folks, and thank you so much for joining us on a Friday afternoon. My name is Yazid Al-Hamarni. I am the scientific officer of the Alberta SPOR Support Unit. And as Finley said, I'm going to talk to you a little bit about how to access the services and then a little bit about the application and how to go about it. Next slide, please. So as Finley said at the start, so our website is www.absporu.ca. And when you go into the website and you want to apply or you want to access any of our services, please, you will have to click on the data and services. Usually when I'm doing this, there'll be animation and some drum rolls and all that stuff. But unfortunately now with the reality of COVID, we have to do it online. So animation was cut off of this one. Next slide, please. Once you click on data and services, you will scroll down to the bottom of the page and then you will see those things. So if you click on service application, you will get the application, and we're going to go through the application in a little bit. So you will download a PDF. It's a fillable PDF. So you will have to complete it. And then once it's completed, you will email it to absporu@albertainnovates.ca. Next slide, please. So usually I'll have some pictures or some photos from the actual application form, screenshots, just to show you what it looks like and everything, but we are actually in the process of changing that. So this is some snippets of what the request form actually would look like, what kind of information we will request. So really quickly going through the request form, the first thing that we usually ask about is a contact form and what is the role of the person who's doing the work in the project. Second, we will ask about the study information. So what's the study title, funding, and then the ethics, and then what's the start and the end date. Usually because in the past, what happened before we actually had the dates in is that people will come to us and they would say, hey, can we have this service and can we have it yesterday? So at least now we will have a start and an end date, and then that will give us and you a fair warning about what's going on, and then that will guarantee that you will get our undivided attention. Going forward, we're going also to ask about if you're receiving any funding from CIHR or any other SPOR entity, or if you have any availability or any work that you're doing with the SCNs. And then afterwards, we put the definition of patient-oriented research as what Finley said. So we ask you to tell us, how is your project patient-oriented? If you have any plans, or what are your plans for end-user engagement? What is the potential for impact? And then afterwards, there's a short description of the study. So we have a lay abstract and a project abstract. And the reason why we have both of these things is that, as you know, with SPOR's strategy for patient-oriented research, so when we're telling other people about what we do, or we're sending reports to patients or to any of the other funders, it'll be good for them to see the type of projects and what's going on, the type of projects that we're funding. And then you will see the project abstract. And then afterwards, we ask you to tell us what kind of services or what kind of support do you require from AbSPORU. I get this thing a lot where people will just, you know, sometimes roll their eyes in front of me, and sometimes they will virtually roll their eyes and they're like, come on, do we have to fill another request form? We have filled so many, you know, in our day and so on. But the idea is, honestly, as you can see, it's very simple, very straightforward, and more often than not, and I shouldn't be saying this out loud, but you can copy and paste a lot of the work either from your proposal or from your ethics application. Next slide, Denise. So in terms of services, as Finley said, we have 4 teams, but 3 of them will directly provide services to investigators. You will receive services from the patient engagement team, from the knowledge translation and implementation science team, as well as the data and services team. What I'm going to do in the next few slides is I'm going to go through the services that are available, and then Paul, Denise, and Jeff will go through the services in further detail. Next slide.
Sorry, Yazid, there's quite a bit of noise in the background. I don't know if it's you or somebody hasn't muted.
Okay. Is this better? Yeah.
Better.
Okay, good stuff. Yeah, okay, perfect. Okay, so in terms of patient engagement, the services that you will receive is identify patient research partners, establish patient advisory groups, access team training, capacity development, mentorship or coaching, development a patient engagement plan, engage community groups, evaluate patient engagement experience, and then PACER. PACER is patient and community engagement research. And as I said, Paul is going to provide more information about these services. Next slide, please. Denise is also going to go through this in further detail, but what can you expect from the knowledge translation and implementation science team is developing a knowledge translation plan, developing integrated knowledge translation proposal, assessing barriers and facilitators to implementation, developing a sustainability plan, developing an implementation plan, evaluating implementation, identifying appropriate implementation strategy, assessing implementation readiness, stakeholder mapping, and then assistance with developing knowledge translation products. Next slide. In terms of data and services, as Finley said, we can provide support for primary and secondary data and also qualitative and quantitative projects. So our services, we could help you with the design and methods. So if you need any help with fine-tuning your research question, or what type of method do you need to do? Do you need to do qualitative? Do you need to do quantitative? Do you need to go and collect data? So go and do primary data collection or use what's available in terms of secondary data. And do you need to do a randomized control trial or a cohort or things like that? We can help you with all these services. In terms of data, we could help you with the data access, so data access, extraction, and linkages, as well as the data management. And what goes under the data management is building databases or building case report forms or data collection sheets. And then biostatistics is actually a full service from A to Z. So if you need any help with developing your analytical plan or the sample size calculation or somebody to do the stats for you, we have the experts who could help you with that. And in the 2.0 iteration as well, we could help you with providing a specialty primary care services. This is through the PICN team or the PICN group. And then an example on this will be connecting you with primary care providers in the community. So if you need to work with any partners in the community, we can help you with also connecting with this team. Next slide. And with this, I'm going to pass it to Jeff. Jeff Bakel is one of the leads for the data for the DRS team. Jeff, take it away.
Thanks, Yazid. So I'm Jeff Bakel, and I co-lead the data science and research services team with Dr. Huda Kwan from Calgary, and we've got our two associate directors, Eric Youngson and Bing Lee. So you can go to the next slide. So for SPOR 1.0, we were tasked with facilitating data access for researchers. And so what we did was built out most of our team inside Alberta Health Services Data and Analytics. And through that, we've built out the group, which is now Provincial Research Data Services. And so we've been able to work with a lot of investigators, as Finley mentioned, from different areas and other patients and analysts on a bunch of projects. So through this, our data platform has grown beyond our SPOR team. And so we've also got a few embedded analysts from some of the SCNs and a few other partner groups. And so we've got starting to get a pretty good group of analysts who are experts with the data. And we like to work with the various teams and be collaborators in the research process. You can go to the next slide. Since the start of SPOR, we started with a median time in Alberta for research data access around 186 weeks. And then by having their specialist analyst team, we've been able to drop it down, to 3.4 weeks. We're probably a little higher right now because some of us have been seconded to COVID work, but hopefully we'll see the other side of that soon. And then through this time, we've been able, through some strategic data acquisition and working with the data and analytics team in AHS, we've been able to expand the available data sets from 16 to 56, where we're at right now. And we're expanding out more with Connect Care as that rollout continues. Go to the next slide. So the current state, so as mentioned, we were providing a lot of in-kind access through the Data and Research Services team, and through SPOR 2.0, we'll probably be looking for a little more cost recovery. And I think that's where the question that Yazid had mentioned about including if you've got funding for your strategy. I think there was one animation in there, so you can click it again. There we go. And yeah, so over the last 5 years, we've done about 840 projects since we launched. And then our team has been sort of growing pretty steadily. So in the last year, we've done 217 projects. And so our, again, our median completion time has been kind of 5 to 6 weeks. And through that, we've done, a lot of that has been data access, but then we've started to do a lot more analytics. So go to the next slide. So by being embedded in the health system, we've got access to the data inside Alberta Health Services, and there's lots of familiarity with the data and analytics warehouse. So we've got lots of data from various aspects. We've got our community pharmacy, our hospital data, inpatient data, and we're able to link it with a lot of external data. So through all that, we've expanded our reach. Most of our data goes back to kind of the mid-2000s and then up to current data. And again, as Connect Care rolls out, we're starting to add in a lot more. You can go to the next slide. So in terms of our services and work that we're doing, so we do have a lot of data access requests. We've been branching out into study and trial recruitment, which is, we've built out a patient contact registry inside AHS, so we're able to do some targeted mail outs to invite patients to participate in research. We're doing a lot of linking to external data sets, so bringing data from primary collected data and linking it to data inside the warehouse, assuming we have ethics and consent to do all that. And then that allows us to give some long-term outcomes, that kind of stuff. We've set up a lot of matched cohorts for people, so we can, use the provincial data to do kind of case control studies. Working with our operations team, we've been able to create a lot of dashboards. We do a lot of work in Tableau, and that's allowed us to do a lot of kind of near real-time work. And especially that's become important through the pandemic. With Connect Care rolling out, we're getting into a lot of natural language processing and building out our skills there. And then, as Yazid mentioned, we do a lot of biostat analysis and visualization. And then as we go on, we're looking to work with Connect Care to build in some decision support models and other things like that. And then a big chunk of what we've been doing too has been educating analysts within our team and others to make better use of the data. Go to the next slide. So for our SPOR 2.0, we're really looking to keep building out our research network and work with the learning healthcare system. We've got a lot more, a lot of collaborations happening with with primary care, with PCNs, strategic clinical networks, and First Nations communities. And, our goal is really to be woven into the fabric of research for the province. And with that, I will turn it over to Kelly.
That's great. Thanks very much, Jeff. So my name is Kelly Buckrice, and I'm the Associate Director for the Capacity Development Platform with AbSPORU. I work with our platform lead, Dr. Sophia Ahmed, and our team members, Amanda Wagner and Christine Selinger at the University of Calgary. Next slide, please, Denise. So fostering capacity development in patient-oriented research is critical to achieving Alberta SPOR's goals of enhanced patient outcomes and health system transformation. And in line with our mandate from CIHR, we provide inclusive and equitable access to training opportunities for all research partners, including patients and patient partners. Next slide, please, Denise. We offer a robust and integrated portfolio of formal and informal training opportunities and resources, including courses, workshops, and events delivered throughout the year. We provide direct support to graduate students through our Studentships program in partnership with Alberta Innovates. We're working to support the uptake of patient-oriented research training in formal education contexts. We collaborate in capacity development initiatives regionally and nationally with other SPOR entities and non-SPOR organizations. And we contribute to the body of literature on program improvement through publications. And next slide, please, Denise. So we envision our capacity development programming to comprise the four main areas that are shown here. And Denise, if you could go to the next slide. Here we've got a more detailed snapshot of the programming within each of these four areas. And I should note that most of this is carried out in partnership with the other Alberta SPOR platforms and stakeholders and partners. I won't have time to describe everything, so I'll share just a few highlights. At present, Alberta SPOR offers certificate programs in pragmatic clinical trials, health data analytics, and implementation science. Our pragmatic clinical trials certificate is CME accredited. We're currently developing a certificate program on equity, diversity, and inclusion, and sex and gender-based analysis plus, which we hope to launch in January 2022. We have currently 3 introductory e-learning modules on patient-oriented research that will be launched very soon on our website. And we also offer an online course available that provides a more comprehensive introduction to patient-oriented research. We deliver a graduate course through the School of Public Health at the University of Alberta. The course is SPH 566, Foundations in Patient-Oriented Research. And enrollment in the course is open to all Alberta graduate students through the Western Dean's Agreement. Each year, our studentship program funds up to 15 Alberta-based graduate students for $30,000 each for a period of 1 year. The competition typically opens for applications in August each year and closes in October. The studentship program provides training opportunities and experiences that support students to achieve a set of national and Alberta-focused competencies in patient-oriented research, theory, and practice. And this includes activities such as consultations with Alberta SPOR experts and our patient partner experts as well. We deliver an annual conference event that provides inclusive engagement and capacity development opportunities for all of our stakeholder audiences, including patient partners, both as contributors to the event and participants. And some of you may have actually participated in our event last year, which was the Virtual Institute. We typically run the event in person, but obviously, for obvious reasons, moved it online last year. But that gave us a chance to explore some new innovations for enhancing diversity and inclusion. And we're planning again this year to hold the event virtually, and that will take place in the fall of 2021. I think my colleague from the patient engagement platform will speak more about the PACER program. So I'll just end with one final highlight. Alberta SPOR has provided funding support for physicians to complete training relating to Connect Care as part of the Physician Builder program. And we'll be looking for more opportunities to continue that support in the future. And with that, I'll end and I'll turn it back over to Denise. Thanks very much.
Great, thanks, Kelly. Hello, everyone, and thanks for coming to today's webinar on a Friday afternoon, as Diane mentioned. My name is Denise Thompson, and I'm pleased to speak on behalf of the two leads for the Learning Health System team, Dr. David Johnson, who is at the University of Calgary in the Department of Pediatrics and the Scientific Director for the Maternal Newborn Child and Youth SCN, and as well as Tracy Wasiluk, who's the Chief Program Officer for the SCNs, and as well as our team, staff team based here at the U of A, who I'll be talking a bit more about in a moment. So as Finley mentioned earlier, a key focus for the Alberta SPOR Support Unit in Phase 2 is supporting a learning health system. And that's a mandate across the entire unit, and all of our teams do work on that. But the learning health system team, our work is from a knowledge translation and implementation science perspective. Growing out of, many of us worked as the knowledge translation platform in Phase 1 of Alberta SPOR. So I'm going to tell you a bit about our activities in 3 areas. One, our consultation work, and often our consultations evolve into long-term project support. We do some capacity building work, and finally, a big focus for us in Phase 2 is an exciting initiative, the Implementation Science Collaborative, which again is a cross-unit initiative, but we've been kind of taking the lead on it and driving it. So Yazid told you quite a bit about the consultation work we offer, so I won't spend a lot of time on it, beyond pointing out that you can come to us for quite a range of time commitments. So we do short-term work, like we can review your grant, we can have a conversation or two about knowledge translation or implementation science methods, or how to design a study or an evaluation, give you advice on building relationships with stakeholders. With our new leadership with Tracy and David, we're much more tightly tied into Alberta Health Services than we were in Phase 1. And I often describe this as having like VIP access to the heart of the healthcare system. It's really fantastic. And one of the things that's enhanced, one of the many things that is enhanced is the advice we can give you about building stakeholder relationships, because often, especially graduate students or early career researchers can struggle a bit, find Alberta Health Services to be a bit of a black box in terms of knowing who to connect with, who to reach out to, how to do it, and so on. We've also evolved over the years to giving longer term support on projects, and we really enjoy doing that. It's a way that we can really offer value to teams, and we learn a lot from it too and enjoy it. So a couple of projects that Gabrielle Zimmerman and Laura McAlpine, who are our lead knowledge translation and implementation science staff, have worked on. They've worked with the Diabetes, Obesity, and Nutrition SCN around an initiative on basal bolus insulin therapy. And Gabrielle is currently working with on incremental dialysis project as well. And one thing we've just started in the last couple of months is an involvement in a massive project underway in Alberta Health Services around reducing length of stay and quality improvement in acute care and surgery. So again, we're really, really pleased to be doing that type of work and to be able to offer our expertise to the system in that way. We have always had capacity building as a focus for us. When I started as the associate director for the KT platform back in 2014, one of the first things I did was talk extensively with people across the province about their needs in KT, and they told me very clearly that capacity was a big need. Building that capacity, the training and education was important. In 2 years ago, I believe, we launched something that we had been wanting to launch since the start of our platform, and Kelly was really heavily involved in that. It was our online certificate. We initially called it our knowledge translation certificate, but for the third offering this fall, we are rejigging it somewhat to be focused on implementation science. This has been a really, really popular offering. As you see on our screen, our 2020 offering sold out in 45 minutes. And we have, at this point, almost 80 people on our list asking to be notified when we open registration in the fall. So that's, clearly that need that was expressed to me back when I started is still there, and our services are appreciated. We've also offered many workshops over the years, both sort of traditional workshops where we run them and open them to registration, and have also offered bespoke or tailored workshops to groups at various points when they have come to us and expressed a need for group training. And so that's something we're able to do as well. So as I mentioned, a big focus for us in phase 2 will be the Implementation Science Collaborative. And that's a big phrase. What it is a mechanism to bring together folks from the health system, people from universities, linked together with expertise from the Alberta SPOR Support Unit, with the goal of facilitating spread, scale, and sustainment of health innovations in Alberta. We're taking advantage of the strengths in Alberta's healthcare system, such as the Single Health Authority, the presence of the SCNs, which are already a fantastic facilitator of learning and spread and scale in the health system. So a lot of strength. And so those existing strengths, along with the facilitation from AbSPORU and our phase 2 focus on a learning health system, really make this a great time to be launching this type of initiative. So what the collaborative is doing, we're launching it this fall, we're still working hard in the design phase, is bringing together leaders from various healthcare communities around the province. So we've been working very hard lately in outreach to a lot of different folks within AHS and other organizations around the province, bringing them together into our ISC steering committee. And through doing that, we're tapping into their knowledge of the system, the implementation barriers that may be in the system that may be slowing down the adoption of new practices. And on the other hand, we're bringing those folks together with our implementation science experts who form our scientific advisory board, who can examine those barriers that are raised and make suggestions about research designs that could study the barriers, ways of addressing them, and also evaluation measures that we could embed into projects. So we're bringing together 2 sets of experts, again, facilitated by the AbSPORU infrastructure. And so as a result of those linkages, we have a working group as well, made up of folks from AHS, universities, and AbSPORU that will take forward the recommendations. And so the ISC is a tool for promoting the recommendations about research, identifying teams that can take work forward, brokering relationships, which, as I mentioned earlier, is a key aspect to facilitating the relationship between the health system and academia, coordinating data capture and analytics, which is always crucial for measurement, and crucially, cataloging the lessons learned. Because often projects in the system are done so quickly that people move on right away and don't look back to capture what's been learned and the wisdom that's been gained. So we want to contribute to that as well. Okay, so with that, I'll turn things over to Paul.
Thanks so much, Denise. So hi, everyone. My name is Paul Ferry. I am the Associate Director of the Patient Engagement Team. I'm based at the University of Calgary, where most of our team is. One of us is up in Edmonton as well. So our provincial lead is Dr. Maria Santana, who is appointed to both Pediatrics and Community Health Sciences at UC, and her research focuses on patient engagement as well as patient and family-centered care. So what is the patient engagement team as part of Alberta SPOR? So the short version that I like to pitch to people is that we are here to animate patient engagement in health research across Alberta. So who are we? So we're made up of a small multidisciplinary team with various expertise. So my background's in social science. We have a few people who are specialized in either patient or community engagement as a practice, and we'll talk about what we can do with those approaches. We also have some health services researchers and other researchers, as well as affiliated with our team to provide some of the services that you've heard about. We're also a provincial council and network. So we have the Albertans for Health Research Advisory Council, which is made up of patient research partners, health services researchers, some health service administrators, and some community organizational representatives, as well as a broader network of patient partners who are interested and activated to engage as partners in health research projects. So on the next slide, please. So what can we do for you? So as with many of the other teams, we do provide services to researchers. So a main activity that we're engaged in is helping to connect researchers and patient and community members to work as patient research partners and equally as active and equal partners. So what does it mean to be a patient research partner? We use that language to contrast with participants in research. So participants in research are often the subjects of the research studies, and certainly a very important role in our understanding of health. But patient research partners are patient and community sort of members, I guess, who are partners on the actual research team, who can help with designing and implementing and analyzing the data and working really as partners, again, on the team. We also build capacity in patient-oriented research on all members of your team, especially in the area of the practice and science of patient engagement. We also support both researchers and patient research partners to work together throughout the research cycle, from recruitment to data analysis and collection, sharing the results, advising on priorities, and so on. So on the next slide, please. So what kinds of things do we do? So we do offer consultations, as described earlier. We often also have these pre-consults, which are sort of like mini consultations to try and find out and assess your needs. We support with grant applications, mostly just to help you flesh out your patient engagement strategies. We offer support with regards to recruitment of patient and community partners. So when you want to work with a patient research partner on your project, we can draw from our network to help you find interested partners for your projects. We can help you build patient advisory groups if you're interested in having patients advise sort of larger research projects generally. And we can also support evaluation of the patient engagement process for your project. So the next slide. So we have a number of resources that we can point you to as well. So again, we do have the Advisory Council and the provincial network of patient partners animated to advise on your projects. We work in national collaboration with various SPOR networks, the Patient Engagement National Working Group. I'll talk about PACER on the next slide, but we'll go through this first. We offer workshops on filling out everyone's favorite thing, the CIHR Common CV. We support patient research partners who will be sort of co-investigators on grants to fill out their CCV. There's some awards, and there's various guides. We have a monthly journal club. We have a podcast, which is some interesting conversations about patient engagement, a YouTube channel, as well as various evaluation tools. So on the next slide. So as I said earlier as well, we work not only in the traditional area of patient engagement in health research, but we also engage in community engagement practices, which is about reaching out beyond individual patient research partners to community groups, often to diversify the types of community members who come forward for studies. So we've been working, for example, on an immigrant youth mental health project in collaboration with a large group called United Voices, which is made up of a few dozen immigrant serving organizations across Calgary, as well as Immigrant Services Calgary themselves and the Mental Health Commission of Canada. And the next slide. As previewed already as well, we're one of the two homes for PACER, which is Patient and Community Engagement Research, which is a sort of a suite of programs, which is a one-year training program for patient research partners, sort of based on the participatory action research methodology, if you're familiar with that. It basically offers a certificate through continuing education at the University of Calgary for people who are interested in working on projects. These projects are all sponsored by either principal investigators or the AHS a lot of the time. So if you have a cohort of 4 to 6 patients who might want to take this training, certainly feel free to contact us there. We also offer through the PACER program from the graduates of the certificate program, PACER consulting services, which is where you can hire a PACER essentially as a research team member to advise you and work on a project. And with that, I'm invite you to ask any questions, certainly to us, and I'll hand it back to Diane.
Thank you. We had a number of